All right, so today I'm going to explain one of the most commonly used topics in clinical practice, that is intravenous fluids, also known as IV fluids, right? So IV fluids are sterile solutions that are administered directly into a patient's vein. They are used to replace lost body fluids, maintain hydration, correct electrolyte imbalance, provide glucose, and sometimes serve as a medium for administering medication, right? So choosing the correct IV fluid is very important because each fluid has a different composition and specific clinical indication, right? So now let's discuss them one by one. First of all, talking about normal saline. So normal saline is basically an isotonic solution, meaning it has nearly the same osmolarity as the blood plasma, right? It is mainly used in dehydration because it replaces the water and sodium lost from the body. It is also the first choice for a shock, for vomiting and diarrhea, right? Another important use is the dilution of intravenous drugs in normal saline, right? And it can also be given in hyponatremia, where the sodium level in the blood is low, helping to restore normal sodium concentration, right? So this is the use of normal saline. Now let's talk about ringer lactate solution. This is commonly abbreviated as RL, right? So basically, RL contains sodium, potassium, calcium, chloride, and lactate. So it makes it a balanced crystallite solution, right? So it is basically widely used in burns, in trauma, right? During and after major surgeries, ringer lactate is frequently administered to maintain blood volume and electrolyte balance, right? And another important indication is metabolic acidosis. The lactate present in RL is converted by the liver into bicarbonate, right? Which helps correct acidosis. Now let's talk about dextrose 5% in water, right? So this solution contains glucose dissolved in sterile water, right? It is mainly used in hypoglycemia, where the blood glucose level are low, so provides an immediate source of energy, right? It can also be used in some cases of hypernatremia, where the sodium level is high, because after the glucose is metabolized, the remaining free water helps dilute excess sodium, right? Dextrose 5% is also commonly used as maintenance fluid in patients who are unable to take adequate fluid orally, right? Now let's talk about dextrose 5% in normal saline, that is DNS, that is commonly used, right? So this fluid basically combines the benefits of glucose and normal saline. It is useful in patients with dehydration associated with low sodium level, right? As it provides both water and sodium replacement. DNS is frequently given to post-operative patients also, who needs hydration as well as a small amount of glucose. It is also suitable as a maintenance fluid because it supplies both electrolyte and calories, right? Now let's talk about dextrose 25%. So this is highly concentrated glucose solution, right? And is mainly used in severe hypoglycemia, especially when rapid correction of blood sugar is required. It is also commonly used in pediatric patients with hypoglycemia under careful medical supervision and according to appropriate dosing, right? All right. After studying all this, some important points are there to remember during IV fluid administration. Like always assess the patient first, right? Then follow the correct rate of infusion. That is, never infuse fluid too rapidly unless it is an emergency such as shock, because rapid infusion can cause fluid overload and pulmonary edema, especially in elder patients or those with heart or kidney disease. Then we should monitor the IV site regularly. We should check for the compatibility before mixing medication, and also monitor blood glucose when using dextrose solution.